Hey, it's Dr. Collins. I wanted to take just a minute and talk about Ken and Diane. It was a recent video I'm sure you guys probably saw. Diane was suffering with really bad hip and sciatic type pain. And then Ken later became a patient with the results that Diane had and was actually suffering with migraines and high blood pressure. So briefly, I want to talk about the mechanism and how the atlas and misalignment in that area can feed some of those symptoms. And so you get a little more of the understanding of how, right? So let's talk about Ken. This is a model of the upper cervical spine. You're gonna have the skull here, the atlas C2, C3. I think it's pretty obvious once I get in here, you're gonna see how high blood pressure can happen, right? The arteries that feed the skull actually run through the atlas. When that area is misaligned, you can see some of the tension that can happen through there with the blood flow. Beyond that, your brain sits up top here and the brain stem actually runs through the spine. If you can imagine having compression or misalignment in that area, the kind of tensions, pressures that can happen on the nerve system, and a lot of people perceive that as a migraine headache. In terms of Diane, a little different situation that sometimes can seem like a stretch, like how does the upper cervical spine affect my low back or hip, right? Well, because of the shape of the joints, they're a little more spherical or elliptical. When the atlas goes out of position, it always comes with some head tilt. What the body does to mitigate that is you always have to keep eyes level. It's gonna tighten up in your low back. Those big muscles of your low back pull really hard. Low back and hip, and it creates a lot of tension in that area. And over time, you can develop muscle spasms, disc problems, nerve irritation. Ultimately, a lot of people have sciatic problems. So in the same way that releasing that upper neck can help with opening up blood flow and taking tension off of that brainstem, dural sleeve, that area with the migraines, releasing that head and neck back into more normal alignment can help open up the entire posture and take pressure off the low back, hip, and nerves, discs, and even sciatic nerve as well. So I hope that makes sense and helps you kind of understand a little more of what they were experiencing from a technical level, and help understand how the atlas can relate to migraines, high blood pressure, low back and disc problems, nerve problems down south there, and even like sciatic type pain. If you're experiencing that, that's why you're who I'm talking to. That's why I'm doing this. I want you to know that there very well could be a solution to what you are feeling day to day, and you don't necessarily have to have drugs and surgery. There may be some other options. So if this is news to you, I would love to hear from you. Shoot us a message on Facebook, send us an email, contact us somehow. We do monthly events. I would love to see you there. We do a dinner with the doc. So please do a little research, check out what we're doing with the content we're putting out, and God bless. Thank you.